What if I told you that waking up 2, 3, maybe even 4 times a night to use the bathroom is not just a normal part of getting older? Because here's what most doctors do not tell you during your 10-minute checkup. There's a very specific set of habits, done in the right order before bed, that can dramatically reduce those nighttime trips to the bathroom. And we're not talking about drinking less water or just cutting out coffee. This goes much deeper than that. Millions of Americans over 50 are losing hours of precious sleep every single night because of something called nocturia, and most of them have no idea that a simple evening routine could change everything. So stay with me, because what you are about to hear might be the most useful thing you watch all week. Let's start with something that might surprise you. Waking up once during the night to use the bathroom is generally considered normal, especially as we get older. But if you're getting up 2, 3, or more times a night, your body is trying to tell you something. That pattern has a name, nocturia, and it affects more than 50% of adults over the age of 50 in the United States. That means if you're dealing with this, you are absolutely not alone. But being common does not mean it is something you just have to accept. Here is why this matters so much. Every time you wake up to go to the bathroom, you are not just losing a few minutes of sleep. You are interrupting what scientists call your sleep architecture, the natural cycles your body moves through during the night. Deep sleep, the kind that repairs your heart, sharpens your memory, and balances your hormones, gets cut short every single time you wake up. Over weeks and months, this builds into something called chronic sleep deprivation. And research from institutions like the National Institutes of Health has linked chronic sleep deprivation in adults over 50 to a significantly higher risk of heart disease, type 2 diabetes, cognitive decline, and even falls and accidents. So those nightly bathroom trips are not just annoying. They can genuinely affect your long-term health. Now, before we talk about the routine itself, it helps to understand why this happens in the first place. Because the cause is not always what people assume. Most people think it is simply about drinking too much water before bed. And yes, fluid timing does play a role, but it is only one piece of a much bigger puzzle. There are actually several things happening inside your body that contribute to nocturia, and once you understand them, the solution starts to make a lot more sense. First, as we age, our bodies produce less of a hormone called ADH, antidiuretic hormone. This is the hormone that tells your kidneys to slow down urine production at night. Younger people produce a surge of this hormone once they fall asleep, which is why children and young adults can sleep 8 hours without a single bathroom trip. But as we get older, that nighttime surge becomes weaker. The kidneys keep working at nearly the same pace all night long, and the bladder fills up faster than it used to. Second, the bladder itself changes with age. The muscular walls of the bladder become less flexible and sometimes more sensitive. This means the bladder can hold less urine than it once could, and it may start sending urgent signals to the brain even when it is only partially full. In women, this is often worsened by hormonal changes after menopause, which cause the tissues around the bladder and urethra to thin and weaken. In men, an enlarged prostate, something that affects the majority of men over 50, can create pressure on the bladder and make it feel like it needs to empty even when it does not have much in it. Third, and this one surprises a lot of people, fluid that collects in your legs and ankles during the day gets redistributed when you lie down at night. If you sit for long periods or have any issue with circulation or mild swelling in your lower legs, that fluid moves back into your bloodstream once you are horizontal, gets filtered by your kidneys, and ends up in your bladder. This is one of the main reasons people who seem to drink normally during the day still find themselves waking up multiple times at night. Understanding all of this is actually great news because it means there are multiple points where you can intervene. You are not just fighting one problem. You are addressing a handful of small factors that, when added together, have been robbing you of sleep night after night. So what does the evening routine actually look like? It starts earlier than most people expect. A lot of people assume the solution is just about what you do 30 minutes before bed. But the truth is, the most effective routine begins around 3 to 4 hours before you plan to sleep. Think of it as setting the stage for your body to do what it is naturally supposed to do, which is protect your sleep. The first step is what researchers and urologists call fluid frontloading. This simply means shifting the majority of your daily fluid intake to the earlier part of the day. Most adults need somewhere around 6 to 8 cups of fluid daily for basic hydration. The goal is to get most of that, roughly 2/3, before 3 or 4 in the afternoon. Then you gradually taper down in the evening. This is not about dehydrating yourself before bed. Dehydration actually irritates the bladder and can make things worse. It is about timing your fluids so your kidneys are doing their heaviest processing earlier in the day, not at 2 in the morning. The second component involves your diet in the hours before bed, and this is where many people accidentally make things worse without even knowing it. Certain foods and drinks are what doctors call bladder irritants. They stimulate the bladder lining and increase urgency and frequency. Caffeine is the obvious one, and most people know to avoid coffee late in the day. But caffeine hides in places people forget about: chocolate, certain teas, some sodas, and even some over-the-counter headache medications. Alcohol is another major bladder irritant that also suppresses the antidiuretic hormone we talked about earlier, which is a double hit on your nighttime bladder control. Spicy foods, tomato-based products, artificial sweeteners, and carbonated drinks can also trigger bladder sensitivity in many adults over 50. Now, this does not mean you can never enjoy any of these things. It means timing matters. Enjoying a small piece of dark chocolate after lunch is very different from having a cup of herbal tea that is actually loaded with bladder-irritating compounds right before bed. Reading labels and shifting certain foods earlier in the day can make a noticeable difference within just a week or 2 for many people. The third part of the routine involves something most people have never heard of: leg elevation in the late afternoon. Remember how we talked about fluid pooling in the legs during the day and then flooding the bladder at night? There's a simple way to combat this. If you spend about 20 to 30 minutes with your legs elevated, even just propped up on a pillow or the arm of a couch, sometime between 3 and 5 in the afternoon, you give that fluid a chance to move through your system earlier in the day when you're still awake and can handle those bathroom visits. This small habit alone has helped many older adults reduce their nighttime waking by 1 to 2 trips per night. And if your doctor has suggested compression socks for any reason, circulation, mild swelling, varicose veins, wearing them during the day and removing them a few hours before bed can have a very similar effect. The socks keep fluid from pooling in your legs while you are upright, and removing them in the early evening allows that fluid to redistribute gradually before you are lying down asleep. This is just the beginning of what the full routine looks like. There are also specific physical exercises, a pre-bed bladder training technique, a few sleep position adjustments, and one particular evening habit that has shown real promise in clinical research for reducing nighttime urination in adults over 60. All of that is coming up, and it builds on everything we have covered here in a way that is genuinely practical and easy to start tonight. Let's pick up right where we left off, because now that you understand why nocturia happens and how the earlier part of your evening can set the stage for better sleep, it is time to talk about what happens in the 2 hours leading up to bedtime. This is where the routine really starts to come together, and honestly, this is the part that most people find the most surprising, because some of it goes against what you have probably been told your whole life. One of the most powerful tools you have available to you is something called pelvic floor training. Now, before you tune out thinking this is only for women or only for people with serious bladder problems, hear me out. The pelvic floor is a group of muscles that sit at the base of your pelvis, and they play a direct role in how well your bladder holds urine and how strong your urinary control is. Both men and women have these muscles, and in both men and women, these muscles weaken with age. When they are weak, the bladder becomes more reactive, more likely to send urgent signals, and less able to hold on comfortably through the night. The good news is that these muscles respond to exercise just like any other muscle in your body. And the research on this is genuinely impressive. A study published in the journal Neurourology and Urodynamics found that pelvic floor muscle training significantly reduced nocturia episodes in older adults after just 6 weeks of consistent practice. 6 weeks. That is not a long time when you consider how many years some people have been losing sleep over this. The exercise itself is simple. You contract the muscles you would use to stop the flow of urine midstream. Not your stomach, not your thighs, just those deep internal muscles. You hold that contraction for about 5 seconds, then fully release for 5 seconds. That is 1 repetition. Work up to doing 10 repetitions 3 times a day. The beautiful thing about this exercise is you can do it anywhere, sitting in your car, watching the evening news, or lying in bed before you fall asleep. There is no equipment, no gym membership, no special clothing required. Just consistency. Now here is a technique that works hand in hand with pelvic floor training, and it is called urge suppression. This is something bladder specialists teach their patients, and it is remarkably effective once you practice it a few times. You have probably experienced this. You get a sudden, intense urge to urinate, and your first instinct is to rush to the bathroom as fast as possible. But here is the thing. Rushing actually makes the urge worse. It increases your anxiety, it activates your body's stress response, and it tells your bladder that yes, this is an emergency, empty now. Urge suppression works the opposite way. When you feel that urgent sensation, you pause. You stay still. You take a slow, deep breath in through your nose and out through your mouth. Then you do 3 to 5 quick pelvic floor contractions, those same squeezes we just talked about. What this does is send a calming signal through your nervous system directly to the bladder, telling it to stand down. The urge typically peaks within about 30 to 60 seconds and then fades. You are essentially teaching your bladder who is in charge, and over time, your bladder learns to stop sending those false alarms so aggressively. Practicing urge suppression during the day means that when your bladder tries to wake you at 2 in the morning, you have a much better chance of suppressing that signal long enough to fall back asleep without ever getting out of bed. That alone can be a game changer for a lot of people. Let's talk about your pre-bed routine now, the final 60 minutes before you actually get under the covers. This window is incredibly important, and there are a handful of specific things you can do during this time that will work with your body's natural rhythms rather than against them. Start with what urologists call a double void. About 30 to 45 minutes before bed, go to the bathroom and urinate normally. Then, instead of leaving, wait about 20 to 30 seconds and try again. Even if you feel like there is nothing left, bear down gently and try to empty just a little more. This technique helps ensure your bladder is as empty as possible before you lie down, giving you a longer window before it fills up to the point of waking you. It sounds almost too simple, but many people who add this one habit report falling asleep faster and sleeping longer stretches almost immediately. Temperature also plays a fascinating role in nighttime urination that almost nobody talks about. When your body is too warm, blood vessels dilate, circulation increases, and your kidneys actually produce more urine. Sleeping in a cooler room. Most sleep researchers recommend somewhere between 65 and 68 degrees Fahrenheit. Not only improves sleep quality overall, but can help reduce urine production during the night. If you tend to sleep hot, breathable cotton or moisture-wicking sheets can help your body regulate temperature more effectively. Production during the night. If you tend to sleep hot, breathable cotton or moisture-wicking sheets can help your body regulate temperature more effectively. Your sleep position is another factor worth considering. Sleeping on your side, particularly your left side, has been shown to improve kidney function and fluid processing compared to sleeping flat on your back. When you sleep on your left side, the pressure on certain internal structures is reduced, lymphatic drainage improves, and some research suggests the kidneys are able to filter waste more efficiently in this position. It is not a dramatic change, but when you're stacking multiple small improvements together, which is exactly what this routine is designed to do, every piece matters. Now let's talk about something that is gaining a lot of attention in the research community, and that is the relationship between blood sugar and nighttime urination. This connection surprises a lot of people. When blood sugar is elevated, even mildly, even in people who have not been diagnosed with diabetes, the kidneys work harder to filter the excess glucose out of the blood, and they pull extra water along with it to do that filtering. The result is more urine production, often at night. This is why people with uncontrolled blood sugar or prediabetes frequently experience nocturia even when they feel otherwise healthy. What this means practically is that what you eat for dinner and in the hours before bed can have a real impact on how often you wake up. High carbohydrate meals in the evening, things like white bread, pasta, white rice, sugary desserts, or sweetened drinks cause blood sugar to spike and then requires the body to work overtime to process it. Choosing dinners that are higher in lean protein, healthy fats, and fiber-rich vegetables helps keep blood sugar steady through the night. A small protein-rich snack before bed, a few nuts, a hard-boiled egg, or a small portion of Greek yogurt can actually help stabilize blood sugar overnight and reduce kidney activity during your sleeping hours. There is also a supplement that has shown genuine promise in peer-reviewed research, and that is magnesium. Many Americans over 50 are deficient in magnesium without knowing it, and this deficiency has been linked to both poor sleep quality and increased bladder sensitivity. Magnesium helps relax smooth muscle tissue, including the smooth muscle of the bladder wall. It supports the nervous system in a way that can reduce those overactive bladder signals at night. A modest dose of magnesium glycinate or magnesium citrate taken in the evening has helped many older adults sleep longer and experience fewer nighttime bathroom trips. That said, always check with your doctor before adding any new supplement, especially if you take medications or have kidney concerns. Speaking of the nervous system, stress and anxiety are massively underrated contributors to nocturia, especially in adults over 50. When your nervous system is in a heightened state, it keeps your body on alert. Your bladder, being highly sensitive to signals from the brain, responds to that alertness by staying in a kind of standby mode, ready to send urgent signals at the slightest provocation. Chronic stress, worry about health, financial concerns, or even the anticipation of waking up to urinate can create a feedback loop that makes the problem significantly worse. A simple wind-down practice in the 30 minutes before bed can help break that cycle. This does not have to be meditation or anything complicated. It might be gentle stretching, slow, deep breathing, reading something calming, or even just sitting quietly with a non-caffeinated warm drink. The goal is to shift your nervous system from that alert, activated state into a calmer, more restful one before you ever close your eyes. When your nervous system is calm, your bladder tends to be calmer too. One final thing for this part of the routine, and this one ties everything together beautifully. Keeping a simple bladder diary for just 3 to 5 days before you start making changes can be incredibly useful. You do not need anything fancy, just a small notebook or even your phone's notes app. Write down what you drink and when you urinate during the day, and how many times you wake up at night. This gives you a baseline and helps you identify your personal patterns. Maybe you're having a large glass of water with your evening medications at 9 o'clock. Maybe you're having a bowl of tomato soup for dinner without realizing it is a bladder irritant. The diary makes the invisible visible, and once you can see your patterns clearly, adjusting them becomes much easier. All of these pieces, the pelvic floor work, the urge suppression training, the double void, sleep temperature, blood sugar management, stress reduction, and that simple diary, are not random tips thrown together. They are a coordinated system, each one reinforcing the others. And together, they create the conditions your body needs to do what it is supposed to do at night, which is rest, repair, and sleep. And now we arrive at the part of this conversation that really brings everything home. Because knowing what to do is one thing, but understanding how to make it stick, how to troubleshoot when things are not going perfectly, and how to know when something more serious might be going on, that is what separates people who see real lasting change from those who try something for 3 days and give up. So let's finish this out together. First, let's talk about consistency and realistic expectations, because this is where a lot of people get discouraged. When you start this routine, do not expect overnight miracles. The bladder is a creature habit. It has been operating on a certain schedule, responding to certain signals for years, possibly decades. Retraining it takes a little time. Most people who follow this kind of routine consistently begin noticing a difference within 1 to 2 weeks. Some notice changes in just a few days. Others take 3 to 4 weeks to see significant improvement. What matters is that you're patient with yourself and that you stick with the routine even on the nights when it does not seem to be working yet. Think of it this way. If you started a new exercise program to strengthen your legs, you would not expect to run a mile effortlessly after just 2 days. You would give your muscles time to adapt and grow stronger. Your bladder and pelvic floor are no different. They need repeated, consistent signals before they genuinely change their behavior. And when they do change, that change tends to be durable, meaning you do not have to keep working as hard to maintain the results once your body has reset to a new normal. One of the most helpful mindset shifts you can make during this process is to stop thinking of your bladder as the enemy. A lot of people develop real anxiety around their bladder, watching the clock, worrying about how long they have been asleep, dreading the moment they feel that urge in the middle of the night. That anxiety, as we touched on earlier, actually makes the problem worse. Your brain and bladder are in constant communication, and when your brain is sending signals of fear and urgency, your bladder picks up on that and responds in kind. So part of the work here is mental as much as it is physical. Try reframing your thinking. Instead of dreading the night, remind yourself that you are actively doing something about this. You're following a routine that is backed by real research. Your body is learning something new. That shift in perspective, from helpless to empowered, genuinely changes how your nervous system responds, and that has a direct effect on your bladder behavior. Now let's talk about some additional habits that can support everything you have already built into your evening routine. One of them involves your daytime activity level. Regular physical movement during the day, even something as gentle as a 30-minute walk, significantly improves circulation, reduces fluid pooling in the legs, supports healthy blood sugar levels, and promotes deeper, more restorative sleep at night. All of these things directly reduce nocturia. You do not need to be doing intense cardio. A consistent daily walk, some light stretching, maybe a gentle yoga session a few times a week. These are the kinds of movements that quietly and powerfully support your bladder health from the inside out. Hydration quality is also worth mentioning here, because not all fluids are created equal when it comes to your bladder. Plain water is your best friend. It hydrates without irritating. But many people replace a good portion of their daily fluid intake with things like coffee, tea, juice, sports drinks, or sodas, all of which can be irritating to the bladder lining to varying degrees. If you can shift more of your daily hydration toward plain water, especially in the morning and early afternoon, and reserve any other beverages for earlier in the day as well, you're giving your bladder the cleanest possible environment to work in. Herbal teas deserve a special mention here, because a lot of people switch to herbal tea thinking it is a bladder-friendly alternative to coffee, and sometimes it is, but not always. Peppermint tea, for example, can relax the sphincter muscles and actually worsen bladder control in some people. Green tea, despite being lower in caffeine than coffee, still contains enough caffeine to irritate a sensitive bladder. Chamomile is generally well tolerated and may even have a mild calming effect on the bladder. If you enjoy herbal tea in the evening, chamomile is usually your safest choice. And keeping the cup small, about 6 ounces, is wise. Let's spend a moment talking about medications, because this is something that often gets overlooked entirely. Many common medications taken by adults over 50 can contribute to nocturia, and your doctor may not have connected the dots for you. Diuretics, sometimes called water pills, are prescribed for high blood pressure and heart conditions, and they quite literally increase urine production. If you're taking a diuretic, when you take it matters enormously. Taking it in the morning rather than the evening means most of its effect runs its course during the day when you are awake. If you're currently taking a diuretic in the evening, talk to your doctor about shifting the timing. That one conversation could dramatically change your nights. Other medications that can affect nighttime urination include certain antidepressants, calcium channel blockers used for blood pressure, some antihistamines, and even certain sleep aids. This is not a reason to stop any medication on your own. Please never do that without speaking to your doctor first. But it is absolutely worth having a conversation with your healthcare provider about whether the timing or type of any medication you're taking might be contributing to your nocturia. You have every right to ask that question, and a good doctor will take it seriously. Now, here is something important. Knowing when your nighttime urination might be pointing to something that needs medical attention. For most people, nocturia is a lifestyle and aging-related issue that responds beautifully to the kind of routine we have been discussing. But in some cases, frequent nighttime urination can be a sign of something that needs to be evaluated by a doctor. If you're waking up 5 or more times a night, if you're experiencing pain or burning when you urinate, if you notice blood in your urine, if you have significant swelling in your legs or ankles, if you're extremely thirsty at night, or if you're experiencing any new and unexplained symptoms alongside the nocturia, please see your doctor. These can sometimes be signs of conditions like a urinary tract infection, heart failure, kidney disease, uncontrolled diabetes, or in men, a more advanced prostate issue, all of which require proper medical evaluation and treatment. This routine is not a replacement for medical care. It is a powerful complement to it. Many urologists and sleep specialists actually recommend exactly these kinds of behavioral and lifestyle strategies alongside any medical treatment, because the combination produces far better results than either one alone. Let's also talk about sleep hygiene more broadly for just a moment, because the quality of your sleep affects how your body handles nighttime urination in ways that are easy to underestimate. When you're in deep, quality sleep, your brain releases more of that antidiuretic hormone we talked about at the beginning of this video, which slows down your kidneys. But when your sleep is shallow, fragmented, or disturbed, even for reasons that have nothing to do with your bladder, your body produces less of that hormone, and you're more likely to wake up and feel the urge to go. So improving your overall sleep quality creates a virtuous cycle where better sleep leads to less urination, and less urination leads to better sleep. Keeping a consistent sleep and wake time every day, yes, even on weekends, is one of the single most powerful things you can do for your sleep architecture. Going to bed and waking up at the same time helps regulate your body's internal clock, which in turn helps regulate hormone production, kidney function, and bladder behavior during the night. Avoiding bright screens in the hour before bed, keeping your bedroom dark and quiet, and avoiding large meals late in the evening all support deeper, more uninterrupted sleep. For those of you who wake up in the middle of the night and find it difficult to fall back asleep after a bathroom trip, there's a technique worth trying. When you wake up, move to the bathroom calmly and slowly. No rushing, no bright lights if you can avoid it. Use a night light instead of turning on the overhead light, because bright light immediately signals to your brain that it's time to wake up, making it much harder to fall back asleep. Keep the experience as quiet and undramatic as possible. Then return to bed, do a few slow, deep breaths. And if your mind starts racing, gently focus on the sensation of your body resting against the mattress. This kind of mindful, calm return to bed significantly improves your ability to fall back asleep quickly rather than lying there wide awake at 3 in the morning. You have now heard a complete, practical, research-informed routine for reducing nighttime urination and reclaiming your sleep. From fluid timing and diet adjustments, to pelvic floor exercises and urge suppression, to blood sugar management, sleep position, stress reduction, medication timing, and the mindset work that holds it all together. This is a full system, not a quick fix. A real, sustainable approach that treats your body with the intelligence and respect it deserves. You have spent enough nights being woken up. You deserve to sleep. And now you have the tools to make that happen. If this video helped you or gave you something new to think about, please leave a comment below and tell me which part surprised you the most. And if you have a friend or family member who is dealing with this same issue, share this video with them. Because so many people are suffering through this quietly, thinking it is just something they have to live with. It is not. Subscribe to this channel if you want more evidence-based health content designed specifically for where you are in life right now, because we're just getting started. Please remember that the information shared in this video is for educational purposes only and is not intended as medical advice. Every person's body and health situation is different. Before starting any new health routine, exercise program, or making changes to your medications or supplements, please consult with your doctor or a qualified healthcare professional. They can help you determine what is safe and appropriate for your individual needs.